I'm back with another video, and in this video I'm going to be talking about my second semester of the LPN to RN mobility program. I know I uploaded the first one like over a month ago, but I do have the second semester, and then the third video will be the final semester of the program. So the second semester was called Nursing 211 Advanced Nursing Concepts, and I have it written down here on my little notebook, and it was pretty much critical care. So the first semester was us LPNs and like paramedics just reviewing the LPN program. This semester we actually merged in and joined a RN class that was going into fourth semester. So we joined a class of like 50 to 60 people. So during this semester, we had class 2 days a week. And then at the beginning, we had lab twice a week up until we learned all about the IV therapy and ventilation and everything for critical care before we actually started the clinicals. So we did labs for about a month, and then we started clinicals. The cost of this semester was approximately around like $1,100 to $1,200, just depending on if you needed to buy more supplies or needed something extra, but that was like the cost for tuition. So just getting into some of the stuff we learned this semester, like I said, it was critical care. So we learned about the respiratory system a lot, learning about ventilation and ABGs and chest tubes. We talked about lung surgeries, like open heart surgeries, anything that would have a patient admitted into ICU, we learned about it. So we learned about why people like went to ICU, why people went to like cardiac ICU, and all those health disorders. So like I said, lung surgeries, open heart surgeries, hemothorax, pneumothorax, them being in sepsis, shock, brain injuries, spinal cord injuries, stroke, or any type of trauma that landed them into the ICU. We went over everything in that chapter, and this semester was very tough. Learning critical care is hard, and learning about all the ventilator settings and the ABGs, hemodynamic monitoring. We learned about a lot of disorders. We also learned about high-risk OB patients, so pregnant moms that had like diabetes, that had the disorder, the hypertensive pregnancy disorder. I can't think of the name of it, but when they pretty much have to have a C-section or they could possibly die. I think it's like DIC. But we learned about anything high risk dealing with moms and babies. And as far as newborns, we talked about newborns that were born prematurely and disorders they could develop being born like before the 36 weeks, I want to say. So it was a lot to learn. And as far as like class material for class, they did upload like pre-class assignments for us to complete. So pretty much it would go over what we were learning for the day, so you would get an idea of what you were going to be talking about in class. So I would do those. I would print off my PowerPoints. They would also post their PowerPoints that they were going to go over, so you could either print it or like download it to your computer and add more notes as they went through it in class. So I did that. I also utilized my Saunders book because we had a critical care section in that book, and then like the high risk OB disorders in that book. I also used MedSurg Success to answer like practice questions. I utilized Evolve to answer practice questions, and that came with our class and tuition. So it was like an online question bank site. And I think there was a critical care success book, but I don't think I bought that. I think I just used the questions from like my regular Saunders book and on Evolve, but some people did buy that book. And I also utilized Your Best Grade to take my final HESI exam. I ended up making a 90 on my HESI exam, and it was all due to Your Best Grade because their questions were so much similar to the actual HESI questions. I was so excited that I made a 90, but I will definitely say that Your Best Grade helps me out a lot versus using the Evolve questions. They really didn't help, but Your Best Grade, it was very similar to like the wording as the HESI test. And as far as clinicals, we did have clinicals 1 to 2 days a week. And since it was like critical care, we had ICU clinicals. So we went to the regular ICU, the cardiac ICU. We went to just regular med-surg clinicals. We went to a cardiac thoracic floor because we did learn about like chest tubes and like pneumothorax. So we did get to see like some patients that had like actual chest tubes. So that was nice to see. We went back to some OB clinicals, and I also got to see a patient that had that hypertensive disorder, and she had to have an emergency C-section. Her blood pressure at the time was like 200/110. They did an emergency C-section that I got to like stand in and see, and then I got to follow her after the procedure and see how like the nurse was giving her the antihypertensive meds like every 15 to 30 minutes to get her blood pressure down. The patient was asymptomatic, so that was a good thing, but it was just really scary that someone can actually like pretty much stroke out due to being pregnant. So that was really fun to actually see that while I was learning about it. We also had some ER clinicals, so it was just more practice on doing like skills like IVs and seeing people come in with different disorders. I think we had a couple psych, maybe like one, they just threw it in there because we had just learned about psych the semester before. So that was all that we did pretty much that second semester. I mean, once you actually get in the program, you kind of know like what's to follow. So they're all pretty much the same, honestly. You just do class and clinical, and then you have your test and final exams. So that was everything that we learned in the second semester, which was the critical care semester, advanced nursing concepts. So in my third and final video, I will talk to y'all about what we did in my final semester. So in my third video, I will talk to y'all about my preceptorship and how that worked, and like graduation and everything. So if you want to see more content from me, just hit that subscribe button down below. Like and comment what other comment you would like to see after I finish this little series, and I will be sure to get it out to you guys. So just comment down below and let me know what you would like to see, and I will see y'all in my next video. Bye guys.